I can't bring myself to change anything. His memory's in there, I still believe. I lie in there some nights. His fish are still there. His clothes are still in his drawers. His bedroom will never be changed.
I want to thank everyone for coming and making my mum's 40th one to remember. Mum, I don't know where I'd be today without your love and support. The fact you have stayed by my side through everything that's going is still crazy to me. Most parents would have given up on me, but not you.
Belinda Huddy's son Kobee struggled with mental illness all through his teenage years.
I'm honestly so proud of how far you've come with everything, and I'm stoked to call you Mum.
I wish I could get his arms around my neck again the way he used to cuddle me. Yeah. Kobee was my only son, my life. I still have nightmares of the last conversation that we had. I try to be positive, but deep down inside I'm just full of sorrow and hurt and thinking why? How could I have prevented it?
At the age of 19, Kobee was diagnosed with borderline personality disorder or BPD.
He was into risky behaviour. He lost his licence more than he had his licence, binge drinking and abandonment. I wanted to take all Kobee's pain away. I wanted to heal him, but a mother's love just wasn't enough.
Kobee went to hospital multiple times for self-harm. He was referred to various community mental health agencies, including Headspace.
He was just like a ping pong ball. Sometimes he was told he was too high risk to be in a community program, or he was referred to the wrong section, and then the next night we're sitting in hospital again.
In May 2019, after harming himself again, Kobee sought help at hospital. His mum implored staff to admit her son.
All I wanted was some help for Kobee. He tended to get better when he'd had a day or two in hospital with seeing a psychologist, and I begged for a short stay. No rooms, no beds, or he's got BPD, there's nothing we can do, he needs long-term treatment.
Days later, he was back in emergency after losing his job. Despite another episode of self-harm hours earlier, Kobee was discharged.
Not once was he ever seen by a mental health person. They didn't see that he was at risk of suicide. I believe Kobee's passing could have been prevented if he was seen by mental health personnel on the 23rd, because the rest was just the rolling ball to the 25th.
That night, Kobee went out drinking with a friend.
And I'm like, Kobee, please come home. And he's like, I'll be fine, Mum, I'll be fine, I'm having a good time.
Kobee's girlfriend, Krista Burgoyne, picked him up from the city early the next morning.
Tell me nothing, just tell me nothing.
He told me how he wants to help himself and he doesn't want to be like that forever.
Krista got ready and went to work.
I was hesitant. He promised me he would be okay. I gave him the biggest hug. We told each other we loved each other, and I went to work.
At Krista's house, a drunk and depressed Kobee phones SA Health's mental health triage line for help.
Hello, mental health triage speaking. How can we help you now, today?
Every time I think of self-harm, I got told to call you guys.
Every time you think of self-harm? Is that the only strategy you've got for self-harm?
Well, I mean, like, yeah.
The call, in my eyes, was disgusting, heartless.
How do I stop from trying to cut myself more?
I don't know. You just have to stop. But if you've already been in overnight, you've just gone home this morning and you're already dripping blood, and you think that somehow we can fix that, we can't. So I'm going to call an ambulance and send them out to you now, okay? All right?
Are you sure? You don't have to call an ambulance? Like, just give me some advice over the phone or anything?
Like what? I've just explained. Exactly, and that's what I'm telling you. I haven't got any special magical advice. There's nothing, that it's just nonsense to think that mental health triagers could do that.
The nurse notes Kobee's address and calls SA Ambulance.
Hi, it's at mental health triage. I've got a caller on the line. He tells me he's dripping blood. He wants us to fix it, and I can't get much sense out of him. It's driving me to distraction.
Alright, did you want to pop in through?
Yeah, I will. I'll see if he'll talk to, he might, he should, hope he's still there, but he is talking in riddles, so it's hard to understand, yeah. Alright.
Thanks for that.
Kobee had hung up. No ambulance is dispatched.
I believe that if the person on the other side of that phone had a bit of care and compassion, I believe Kobee could have calmed down and got the help he needed, and it wouldn't have ended up in the disaster that it did.
222-040.
Police emergency, what is your location?
1 hour later, Kobee calls 000.
10 cops right now.
What for?
I got a firearm and I'm about to start firing on.
What's your name?
Kobee, mate.
Kobee's never had a gun. His uncle's a police officer.
And what's up today? What's the matter with you?
Mental health, but I just want to shoot some cops because I hate those and I bought a gun already.
My auntie lived across the road. I told her to go check on him.
Send your boys, bro, trust. Sounds like they're to me. What, they hear that I've got a gun and they're not coming, eh?
Krista's auntie, her best friend and Kobee jump in a car to go buy cigarettes from a service station.
Victim 10 for Victim 20s. I've just had a Mercedes-Benz leave the address. I'm on Raymond Avenue. I'm going to do a quick stop. There's 3 heads in it.
They called me, said something's off. We're going to the servo. I told them, no, don't go to the servo. Go to the hospital. Take him to the hospital.
Turning right onto Green Avenue. I'll do the stop once we get around the corner. 2 females, 1 male.
I could hear my best friend was freaking out.
Stopped north of Alfred Avenue on Green.
Roger.
The officer asked Kobee to get out of the car.
My auntie was on the phone to me at the time. She's like, Krista, he's got a knife.
A knife, I've got a knife. I got 1 guy, need help.
Location?
Daddy, where is he?
Patrol calling 801, your location.
Alfred and Green. Patrols Alfred and Green.
Duty called the ambos rolling. Confirmation, offender has been shot by police.
Roger, if you're close by, South's attending UAD.
West End, the police losing consciousness. We need South here straight away.
My best friend said that I died that day. Because when they told me, I just flipped myself onto the floor and started screaming. You hear that? I couldn't even cuddle my son and say goodbye and tell him I love him.
Bell was later shown the body camera footage of the shooting. The officer says he fired after Kobee took 2 or 3 quick steps towards him with the knife.
When they were trying to save him, like the police were really good, like all of them were trying to save his life. And then you just heard his words, I'm sorry. Can't believe it, he just said he was sorry after he'd been shot. You can hear it clear as day.
The South Australian Coroner is examining the events leading up to Kobee's death. Counsel assisting told the inquest the mental health call operator could not be held responsible for Kobee's interactions with police. His mother doesn't blame police, but questions why the officer wasn't certified to use a taser.
The last thing that we want to do is to use our firearm to deal with somebody who is suffering a health episode.
Mark Carroll from the South Australian Police Association says Kobee's death is emblematic of a system in crisis.
Police are there to protect and serve the community and not pick up the pieces for failing mental health departments.
SA Health and SA Police told 7:30 they were awaiting findings from the inquest, but said a trial where mental health nurses accompany some police patrols had seen significant benefits and permanency of the program would be considered. Bill Huddy believes more focus needs to be on early intervention and better follow-up care from community agencies like Headspace.
I feel that they failed Kobee.
Throwing more money at the way we currently do things will not fix it. Much more fundamental structural reform is required.
Professor Ian Hickey was a founding director of Headspace. He says the mental health system is too focused on brief interactions when people are in crisis.
In Kobee's situation, there clearly was an earlier opportunity. And I've heard many similar stories where there was an opportunity, but the opportunity was missed. Not just by Headspace, but by state-based services, by emergency departments, by others, to coordinate that care.
The Health Minister, Mark Butler, has been handed a review into the operation of Headspace.
We're still working through that evaluation and intending to respond to it. The challenge that Professor Hickey really points to is the increasing number of young people with far more complex and severe needs.
Headspace told 7:30 it is dealing with more complex cases and is looking to governments to meaningfully support the mental health system. Kobee's death has had a devastating ripple effect.
Since Kobee's passing, I've got complex trauma, PTSD, depression. I can't sleep. But psychiatrists, there's just waiting lists. Psychologists, there's waiting lists. And unfortunately, tablets don't just fix everything.
I love you, baby.
Kobee was 20 years old. Yeah, 20 years of bliss with my son.
Come here and love me. I love you too.
Belle says she is finding strength by advocating in Kobee's honour for better mental health care.
Kobee's life is lost, but we can save other lives.